and Radio Philippines Network, DXKS, DXKS, Jess 80, ang inyong Radio Ronda, 5,000 watts, nagsibya sa ikatulong Andanar sa UFCO Lim Building, Borromeo Street, Dakbayan sa Surigao. RPN, Radio Philippines Network, DXKS, Jess 80, ang inyong Radio Ronda.
Gawin nating lahat. Not just government. Hindi lang po ito responsibilidad ng ating pamahalaan, ng ating gobyerno, pero responsibilidad po nating lahat. So ang panawagan po natin, all in this together, magtulungan po tayo dito at lahat po tayo, kung may mga kakilala po tayo na hindi pa nagpapabakuna, kailangan kumbinsin po natin sila na magpabakuna. Yung pag-reach po ng target, common goal po nating lahat ng mga Pilipino yan. Buong sambayanan po. Hindi lang yan nakaatang sa balikat ng ating pamahalaan, ng inyong gobyerno, kundi buong bansa po ang dapat maniguro na maabot natin yung full vaccination ng lahat ng eligible na population.
Opo. Tanong naman pa rin po ni John Punsalan, the UN daw po is urging the Philippines to Maria Ressas to travel to Norway next month to accept her Nobel Peace Prize. Will government allow her to do so?
Alam nyo, nasa korte yan eh. It is actually an issue na we leave it to the courts to decide.
Opo.
So as a co-equal branch of government, syempre nire-respeto natin yung proseso ng ating mga korte. So, leave it to the courts to decide.
Opo. Basahin ko lang din po tanong ni Robina Asido ng Daily Manila Shimbun. We would like to ask daw po sa reaction ng Palace about the Japanese government's decision to ban entry of all foreign nationals in their country starting Tuesday due to the Omicron variant. Are we considering doing the same in the Philippines?
Right now, ang ginagawa po natin ay pag may nakita po tayong isang bansa o ilang mga bansa na nagkakaroon na po ng local transmission ng Omicron, ay agad po nating ine-elevate sila sa red list. So yan po yung ating protocols at procedure po dito sa bansang Pilipinas. At yung mga bansa naman na positive, na may positive na Omicron, syempre titingnan muna natin kung ito ba ay imported case or ito ba ay local case na may local transmission. Kapag imported case at hindi naman po local transmission, yung aming policy sa IATF ay wag muna natin agad-agad i-elevate sa red list hanggat makikita natin na number one, na makita naman natin na maganda naman yung surveillance capacity, capability at ginagawang surveillance ng bansang yon. Kung maganda rin naman yung ginagawa nilang genome sequencing. Pero pag medyo alanganin tayo at hindi mataas yung ating kumpiyansa na nakakapag-detect sila ng local transmission ng Omicron, ay nasa IATF po yun, yung discretion na i-elevate siya sa rest kung hindi tayo ganoon kampante sa pagde-detect nila ng local transmission ng Omicron sa kanilang bansa. So yan po yung parameters na sinusunod po ng IATF.
Opo, Kabsec, pahabol na tanong ni Rosa Licos, Mela Lesmora, ni Joe Montemayor. Ano daw po ang reaksyon ng Palace sa withdrawal ni Senator Bongo sa presidency? Is this the decision of the President? What does President Duterte say about this? And who will PDP laban Kusi faction support para po sa presidential elections?
This is very new. These are very new developments, no? Kaya as far as PDP laban is concerned, alam ko magkakaroon ng mga series of ang PDP laban para pag-usapan po ito at hintayin na lamang po natin yung any statement na ilalabas po ng PDP laban tungkol po dyan.
Okay. Maraming salamat po sa inyong oras at panahon, Acting Presidential Spokesperson and Cabinet Secretary Carlo Nograles. Mabuhay po kayo, Secretary.
Maraming salamat sa iyo, Usec Rocky. At tulad ng sinabi ko sa simula ng briefing today, we commemorate the 158th birth anniversary of the founder of the Katipunan, that Andres Bonifacio. Like many of his generation, he died young, fighting not just for himself but for his people, for the Filipinos. Ulitin ko po, ginawa niya ito hindi lamang para sa sarili kundi para sa kapakanan ng kapwa. Napaka-inspiring po ng Andres Bonifacio, pero hindi po sapat na bumilib lang tayo sa kanya, lalo na ngayon. While we fight to end the threat of COVID-19 and to deal with the threats posed by the Omicron variant, we should do more than admire the life he led. We should be inspired to emulate his actions, to care about our countrymen, to consider the welfare of the country and our community, and to work for the common good. Yan po ang hamon ng panahon. This is what the times demand. Pero sa totoo lang, kayang-kaya po nating ibigay ang hiningi mula sa lahat. Mag-mask na maayos, maghugas ng kamay, mag-social distancing, at magpabakuna. Hanggang ngayon, nananatili ang ating panawagan, kailangan nating magtulungan. Maraming salamat po, Usec Rocky. God bless po sa lahat at ingat po lagi.
Salamat po, Secretary Nograles. At para bigyan tayo ng latest report sa nangyaring pambansang pagbabakuna kahapon, makakasama natin ngayong umaga mula sa kanilang headquarters sa PICC, si DOH Undersecretary Mirna Kabutahe, ang chairperson ng National COVID-19 Vaccination Operations Center. Good morning po, Usec.
Magandang umaga, Usec Rocky, at sa lahat ng nakikinig at nanonood sa iyong programa.
Opo, Usec, may final figure na po ba tayo kung ilan na yung nabakunahan kahapon at ilan na po yung partial data natin ngayong umaga?
Yes, Usec Rocky, I have a slide to show that. Unang-una, nagpapasalamat tayo sa ating mga healthcare workers, our public and private sector vaccination partners, lahat, buong bansa po who participated in this whole of nation effort to achieve population protection. We have hit 2.5 million jobs. If we can have the slide, at 2,554,023 ang eksaktong figure as for our November 29, 2021 coverage. This is 2.5 times our average of 1 week, 1 million. Next slide, which puts us on the top 5 spot worldwide in terms of jobs administered in a single day. So, yung kabuuan ng ating report for day 1, pinakamataas po, next slide, yung ating Region 4A with 366,000 jobs, followed by Region 3, Region 6, Region 7, then Region 5. Siya po ang top 5 based on the number of jobs performed. Yung sa dulo ng column, nandoon naman based on their accomplished based on committed targets. So yung mga naka-green, nakikita natin na nakamit ng kanilang committed targets for day 1. And there have been reports, to lang yung ating major challenge, there have been reports that some who walk in were not given vaccination. So, meron pong direktiba ang ating presidente to vaccinate everyone. So, ang directive po ay we allow walk-ins. Dapat po walang uuwi ng nakapila na hindi nabakunahan. Maraming salamat.
Usec, may tanong lang din po, totoo po ba o natagalan yung pagpapadala ng datos kahapon at hindi agad natin nakita yung tunay na mga numero on the ground? Ito po ba daw ay dahil sa kakulangan ng volunteers for data entry?
That is not the main reason. Ang unang dahilan, many of our healthcare workers concentrated magbakuna. They wanted to finish their vaccination activities before they submitted their reports. So many of the reports came after 7, 8 nung tapos na yung kanilang pagbabakuna.
Opo. Tanong naman po ni Red Mendoza ng Manila Times, bukod dito, ano po ang naging initial observation ng NVOC sa nangyaring bakunahan kahapon? May mga nakita ba silang mga issue na kailangang i-resolve ngayon at hanggang bukas po?
Oo, pinag-usapan namin yan kagabi ng ating mga operation center. Tapos kaninang umaga with the Sec Vince, the Dison. Ang unang nakita nating problema ay yung walk-ins not allowed. Tapos yung ibang LGUs did not accommodate yung pediatric vaccination. Siguro some of them had in some areas lang, hindi available in all vaccination sites. Pangalawa, masayang problema, yung there was overwhelming response. Madami pong pumila, maaga pa lang nakapila na sila para mabakunahan. Kaya nga, so this had delayed in the turnover. We needed to control the crowds, so it was very important to maintain social distancing.
Opo.
Tapos yung pangatlo, there was a delay nga in the submission and transmission of the report. Many of the areas wanted to finish their vaccination activities first before they reported.
Opo.
So, anong ginawa natin? So, may direktiba na tayo na yung mga walk-in dapat i-allow natin. Huwag pauuwiin yung mga nakapila na hindi nabakunahan.
Okay.
Yung ating mga reporting naman, we just allow our healthcare workers to report at least the day's activities by the end of the day or even hanggang alas 12 ng madaling araw, hanggang alas 6, nagre-report yan yung ating mga healthcare workers.
Opo, Usec, huling tanong ni Red Mendoza ng Manila Times, sapat po ba daw yung vaccines para sa pedia population na mababakunahan ngayon at bukas?
Yes, we have enough vaccines for our pediatric population. Pfizer and Moderna, ang ginagawa lang nila, one vaccination site or one lane for our pediatric patients. Alam naman natin na our pediatric patients require a bigger space. Kasama nila yung mga nanay nila, yung mga magulang, yung mga guardians nila. So we need a bigger space.
Opo. May mga report din daw, Usec, ng pagdagsa ng mga tao sa mga vaccination hubs. May mga babaguhin di po ba kayo sa protocol sa pagbabakuna dahil sa Omicron variant?
We are working closely with the local government units. Especially today, we're expecting more vaccinists to appear at the vaccination sites. So, nandyan yung ating mga PNP, yung ating mga ibang partners na to keep distance, mga marshal, mga ushers. And then, basta schedule natin na maganda yung ayos ng ating daloy, ng ating pagbabakuna.
Opo. Usec, kumusta rin daw po yung pamahagi natin ng booster shot? Kailan po ito bubuksan sa iba pang sektor, lalo na't pinaghahandaan nga po ng bansa itong panibagong mutation ng COVID-19?
Hinihintay po natin yung EUA ng ating FDA. Pag meron ng EUA ng FDA, magbibigay na tayo ng guidelines kaagad at pwede nang umpisahan ang pagbabakuna ng boosters.
Opo. Usec, kailan po ulit tayo mag-a-announce ng mga dami ng mga nabakunahan? Mamayang hapon po ba malalaman ulit natin yung mga karagdagan?
We'd rather keep it on a daily basis.
Opo.
To give time for our healthcare workers to do really the vaccination. So, hanggang 6 o'clock in the morning bukas, pumapasok yung report. So we will give the next report tomorrow.
Okay, thank you po. Maraming salamat po sa inyong panahon at mga impormasyon. Undersecretary Mirna Kabutahe ng Department of Health.
Maraming salamat.
Kinababahala ng marami ang posibleng pagpasok ng Omicron variant ng COVID-19 sa bansa na ayon na nga mismo kay Health Secretary Francisco Duque III ay inevitable o hindi po mapipigilan. Kaugnay niyan, makakausap po natin ang World Health Organization representative to the Philippines na si Dr. Robbie Abengasinge. Good morning, sir.
Good morning, Usec. Pleasure to be back with you.
Thank you. Welcome, Dr. Robbie. What is your reaction to the new alert levels to be imposed in the country starting tomorrow, as discussed by Cabinet Secretary Nograles a while ago? Do you think it is enough as a precautionary measure for Omicron variant?
Thank you for the question. It's important for the country to be prepared and recognize the threat posed by the Omicron virus. Variant. We are conscious that we don't have a lot of information right now about the potential for transmissibility, the potential for severity of infections, or even its capacity to evade the therapeutics and the vaccines that we have. And in the circumstances, the precautionary approach, the risk-based approach adopted by the country is important, I think, and we are supportive of that. On the alert levels, we support the alert levels because we recognize that COVID-19 is here for the longer term, and we need to manage the risk of COVID-19 without harming the economy and protecting lives. And so the transition from quarantine classifications to the alert levels, which allows for greater economic activity, is welcome, and we support that. And we need to be very carefully monitoring the situation for potential presence of Omicron in the country, and based on the clinical picture and the other facts as we determine them, we will need to decide whether we need a further increase in those alert levels or we can continue with the current alert levels. So it is the way that we have to go. We have to be prepared. WHO has always said it's better to be prepared, more prepared than have regrets later. So preparedness is more important so that we do not have to regret if we didn't prepare and had a major surge. So we welcome the efforts of the government and we are supportive of them at this point of time. Given the fact that we don't know a lot about the Omicron virus, the situation is evolving very rapidly. The first presence of Omicron was reported to WHO only on the 24th of November. And of course, now it's already been confirmed in more than 10 countries. And a lot of them are confirming it among travelers coming from South Africa, Southern African countries. So it's important for us to take a risk-based approach and manage this. It's important for us to increase our alert levels, and by that I mean having stringent measures at points of entry. Also importantly, looking at the whole genome sequencing to detect the presence of Omicron virus, particularly from among returnees from abroad or returnees from the Southern African countries. I would go to say that we should not be looking for Omicron only in countries that have confirmed the virus for now, because there are many countries that the virus may be there, the variant may be there, but have no capacity for sequencing. So any returning overseas Filipinos or foreigners coming in who test positive, I think we need to do whole genome sequencing now. And what is important from a genome sequencing perspective is because of the recent detection of the variant, we need to rapidly do genome sequencing of the most recent arrivals. There is a tendency and a delay in the Philippines to be sequencing samples that are 4 to 6 weeks collected earlier. Right now, I think the importance is to focus on those samples of people who detected positive points of entry or recent arrivals during the last 10 days or 2 weeks, because the likelihood of detecting the Omicron virus will be higher if we do whole genome sequencing in these as a priority, rather than doing whole genome sequencing on older cases. The other important element is that we need to support the Philippine Genome Center to expand its whole genome sequencing capacity so that we are better equipped to detect the entry of Omicron early enough, and we can initiate appropriate control measures and alert levels where we identify the variant to be present.
Dr. Rabi, I'll read some questions from our media partners. First from Lay Alvis of GMA News. Should the countries assume they already have the undetected cases of Omicron variant? In the case of Delta, it was determined later on that it was here as early as March, months prior the first detected case.
Well, it's always difficult to be very specific, and we should not assume that something is here. It needs to be confirmed by testing. They're advocating for testing. But assuming that there is a risk and implementing risk-based approaches, increasing our preparedness and alert level capacities, that is what we need to do. I don't think we need to overreact. We just need to be very rational in our approach as we try to better understand this new variant. But as a fundamentally important component of living with COVID-19, we need to further strengthen our capacity for preparedness and response in anticipation of its potential arrival in the country.
From Red Mendoza of Manila Times, with the WHO declaring Omicron as having the highest global risk, do you think the steps most countries did, such as border restrictions, were the most logical thing to do? This comes after South African leaders said that they were being punished for the discovery of the variant through travel restrictions.
Well, it's up to individual countries to take precautionary measures. WHO has always advocated a risk-based approach. So each country needs to consider the risks of potential importation from countries that are already confirming this variant and take appropriate measures while we try to determine the absolute epidemiological significance of the variant and its response to the preventive treatment protocols that we have in country at the moment in the world. So this is sort of an interior measure right now, and we continue to urge countries to take a risk-based approach in assessing the likelihood of importation. But I want to reiterate again that that risk-based approach should not only target countries that have already confirmed the Omicron variant in travelers or in citizens. We need to be aware of the fact that many countries have limited capacity for whole genome sequencing, and that's why I'm advocating that any returning traveler overseas should be sequenced as a priority so that we get a head start on being able to detect the arrival of the virus variant in the country, learning from our previous experiences with Delta, like you mentioned. So I think it's critically important that we take these measures now.
His next question is, with the looming threat of the Omicron variant, will the WHO agree to mandate coronavirus vaccinations to allow more people to be protected against the virus?
But WHO has always taken the stance that we are not mandating vaccines. People should be free to decide what's best for them. But we have strongly advocated that people, particularly people at risk, are prioritized and provided with vaccines. So because we know that the vaccines are life-saving, the vaccines are capable of protecting people from severe disease, particularly those who are elderly or who have comorbidity. So even as we congratulate the government on the implementation of the next national vaccination days and on the progress in that effort, we continue to re-emphasize the importance of prioritizing and ensuring vaccine access to the elderly and the comorbid populations, particularly now that we are seeing the threat of Omicron in the world and the likelihood of its importation. And I want to reiterate that we still remain concerned that nearly 2.5 million elderly Filipinos have still not had even a single dose of COVID-19 vaccines. So we need to use this situation now and the evolving global situation to emphasize the importance of vaccination for the elderly and the comorbid populations, and to make sure that we protect as many of them as possible as early as possible. Thank you.
Last question of Red Mendoza. The Philippine government has already made the use of face shields voluntarily in areas under alert levels 1 to 3. Many Filipinos have been averse on using the face shields, as some experts claim that it does not really protect a person against COVID-19. What does the WHO think about adding increased protection such as face shields?
WHO has right along said that this is a virus, it's not airborne, right? It's close contact transmission. And that is why we emphasize that what is important is the physical distancing and the face masking and the hand hygiene. If we can ensure that those minimum requirements, those minimum public health measures are complied with, if we can ensure that people don't congregate in closed settings, the requirement for face shields probably at this point of time is not mandatory, because as I said, we are still looking at understanding the transmission dynamics of the Omicron variant. So I think it will be premature now to go there and say we need to reintroduce face shields, because we also know that there is significant public discontent on the mandatory use of face shields. So it's better to get public compliance with the measures that are there and take a risk-based approach to reanalyze whether we need to go into the use of face shields or not.
Yes, Dr. Rabi, may we also know your reaction to the ongoing 3-day nationwide vaccination drive of the government? Should this be replicated in the coming months?
Thank you. We have right along been advocating and supporting the government this effort. WHO and many of our staff and our partner organizations, include UNICEF, are working hand in hand on the ground with the LGUs, with the national governments, with the CHDs to ensure the success of this national vaccination drive. It's important because we are in a scenario that we now have potential circulation of Omicron globally, and even besides that, we are ahead of the Christmas season, when we know that there would be a lot of gatherings and arrivals from abroad. So it is an opportunity for us now that we have a lot of vaccines in country to ensure that those most vulnerable are protected. So we support the national vaccination drive. We are encouraged by the success on the first day, but we still note with concern that in many places there was overcrowding in the vaccination centers. We need to try to minimize this, so we need better crowd control in those places. We need more capacity to vaccinate people. We also note that in many places we have heard of there being no priority lanes for the elderly and the comorbid populations. We need to try to do this, because the maximum impact and benefit of the vaccination is if we can provide access to the vaccines to these groups of people. The other comment that I would like to make is we would like to see and commend those LGUs that have set up mobile vaccination teams to reach the elderly and the disabled. If we can replicate that in those LGUs that have not done so, this would significantly increase access to vaccines for these groups and increase the effectiveness of the national vaccination days. So overall, WHO is fully supporting of the NVD campaign. We are talking with the Department of Health already of a potential replication of the NVDs again within the month of December. I'm not sure which dates will be decided on, but preferably before the holiday season. We need to see whether we can maximize the protection among the population, as we did with the potential arrival of the Delta variant when we increased vaccination in the NCR. Now, with the potential threat posed by Omicron, we need to do the same at a national level, and these NVDs will be a great opportunity for us to increase access to protection for the Filipinos. Now that we have enough vaccines in the country, and WHO through COVAX continues to provide large quantities of vaccines to the Philippines. We just completed 5 million doses delivery over the weekend through dose sharing mechanisms from the United Kingdom. We are looking at another 1.6 million doses to be delivered tomorrow through dose sharing from France. And we are even looking at 9 million doses of J&J and 10 million doses of Moderna coming in the first weeks of December. So all of this effort is meant to protect as many Filipinos as possible. And so we would urge the LGUs to take the leadership and make the arrangements so that more Filipinos can access vaccines, both during the NVDs and between the NVDs, so that we protect as many of them as possible and minimize the wastage of vaccines that are already in country. Thank you.
Dr. Rabi, thank you very much for joining us this morning. WHO representative to the Philippines, Dr. Rabi Abengasinge. Stay safe, Doc.
Thank you.
Samantala, mga small business owners naman sa lalawigan ng Romblon ang binisita at hinatira ng tulong ng tanggapan ni Senator Bongo. Kasama po ang DTI, TESDA at DSWD. Narito ang report.
Todo ang suporta ni Senator Bongo sa mga maliliit na negosyante o yung mga nasa micro-business sa bansa. Dahil sila ang labis na tinamaan ng epekto ng COVID-19 pandemic, tuloy-tuloy ang pag-agapay ng kanyang tanggapan para makabangon ang mga nasa micro-business at entrepreneurs. Sa pagbisita ng kanyang outreach team sa Romblon kamakailan, kasama ang mga ahensya ng pamahalaan, kapit bisig ang lahat sa pagtulong. Kailangan na niyang suportahan ng gobyerno ang kapakanan ng mga maliliit na negosyante para buhayin ang mga negosyo at maiahon ng mga empleyado mula sa krisis.
Sa ngayon po, binabalanse ng gobyerno ang pagbubukas ng ekonomiya. Pero syempre po, uunahin natin ang kalusugan at buhay ng bawat Pilipino. Kaya magpabakuna na ho kayo. Magtiwala ho kayo sa bakuna. Ang bakuna po ang tanging susi o solusyon para makabalik na po tayo sa dati nating pamumuhay.
Bukod sa mga pagkain, mask, tablets at sapatos na pinamigay ng tanggapan ni Go sa halos 1,000 maliliit na negosyante sa 11 bayan sa Romblon sa loob ng 3 araw, may hiwalay na tulong din mula sa Sustainable Livelihood Program ng DSWD ang mga benepisyaryo. Ganon din ang DTI at TESDA, nag-alok ng scholarship at livelihood package sa mga kwalipikadong benepisyaryo.
Senator Bongo, maraming salamat po sa inyo sa ibinigay niyo sa amin na puhunan namin na sana makabangon din kami kahit papaano.
Sa ngayon gagamitin ko po sa pag-alaga ko ng baboy para makaahon po sa kahirapan po. Sa matanggap po ngayon na pira, maraming salamat sa kanya, kay Senator Bongo po.
Gagamitin po namin doon sa pandagdag sa aming tindahan na maliit sa restaurant. Maraming salamat po kay Ginoong Senator Bongo.
Hinimok ni Go ang mga taga-Romblon na lumapit sa Malasakit Center na nasa Romblon Provincial Hospital sa Odjongan kapag kailangan nila ng pantustos sa gastusin sa ospital o pagpapagamot.
Pakiusap lang ho namin ni Pangulong Duterte, magpabakuna na po kayo, mas protektado po kayo. Nasa datos po